I think we're almost ready for that. No, and this is based on what metrics has we been monitoring for the past month. Number one, our healthcare utilization rate has been very low for the past several months, which started even the latter part of 2022. The utilization rate in the ICU, the severe cases, has dropped significantly. And although the positivity rate has a slight uptick in some instances over the past month, but it's still below the 10%, which is the threshold for a WHO alarming cases. So for me, I think we're ready to lift the public health emergency, but there are things that we need to maintain. One is the health protocol should stay, the voluntary masking, especially for high-risk population, the vaccination for the vulnerable population, especially availability of updated vaccine, should be prioritized. And then the third most important one is we need to prepare the healthcare facilities for any eventuality that there will be an uptick of cases. Then we are ready to accommodate those COVID cases.
Right, Dr. Solante, exactly what I wanted to ask you. After the expiration, well, technically, I think, just to clarify, the state of emergency with the COVID-19 here in the Philippines had already lapsed at the end of the 2022. What happens now to vaccinations? I understand that the state of calamity or state of emergency had a lot to do with the funding and the procurement of these vaccines. What happens to the vaccination program now?
Yeah, this is just a slight problem because with the lifting of the state of calamity, the indemnification clause for the general immunocompromised and the healthcare workers, because I don't think we will be ordering volumes and volumes of COVID vaccines. The direction now is really small volumes and availability of bivalent vaccine, and only be given to those high risk for severe infection, as what I've mentioned, the vulnerable. If you're vaccinated, you can still get the infection. So, like for example, if the positivity rate between 5 to 6% or 7%, that's still okay, which means that people are still getting the infection. But what is important, people are not going to the hospital. So on that note, I think the government should also be allocating budget for the healthcare system to maintain its viability, availability of antiviral agents like remdesivir, Paxlovid, and molnupiravir, because these are important treatment options. Do you know why US is so confident in lifting the public health emergency? It's because they have all the means of options to prevent people from dying, to prevent people from getting the severe infections because of their healthcare system.